Welcome to episode 44 of Acadicus Simulation Pulse Live, Friday afternoons at noon Central every Friday. So we appreciate you watching and joining us today. And today we have Mitch Luker from NWTC joining us. And we also have Nikki. I'm going to ask your help with your last name. I've got a difficult last name, so I'm not even going to try.
It's Riki and it's Szymanski.
Szymanski, got it. That's not as hard as I thought it was going to be. So excellent, excellent. Well, welcome to Simulation Pulse Live. We really appreciate you joining us today, and I'm really curious to learn about what you've been doing. And Mitch has shared a couple of videos and some things that you've been working on, but would love to hear about your experience and use case and the problem that you were looking to solve, and what were you building?
So Ricky and I started off working together on um, making a virtual reality lecture because being a student myself and having to watch PowerPoints at home on my own and hear the disembodied voice behind them was really painful. I was like, oh my gosh, how am I going to stay awake during this? Because when it's a 40-minute video and it's just a PowerPoint on a screen, it's painful to watch. And I think about our students who are, coming to class and they're trying to study and do all those things. And so I just reached out to faculty. And I was like, hey, does anyone want to try doing this with me? Because it was the first time we were doing it. And Riki said that she would be happy to do it. So we tag teamed and worked together, and we actually developed our first virtual reality lecture so we did it in Acadicus in 3D, and then I took those 3D recordings and put them into 2D, so that way we could upload them into our learning management system so students can see the PowerPoint while Riki is actually providing care to the patient.
Yeah, I would say exactly what Mitch said, especially for my online students, is for them to sit and watch hours and hours of videos and PowerPoints. And by videos, this is all you see is what my face talking. It's hard to get real animated when you're trying to record these lectures and all I have is this limited screen. So I was really excited to try this out with Mitch. And it'll be interesting to see what students will think. I think one challenge I discovered was that the video gets to be pretty lengthy because now I'm not just saying, well, for fluid volume overload, the vital signs will be this and talking about the different signs and symptoms. Instead, now I'm saying them as well as I'm doing the assessment on the patient. So this ends up being more lengthy in time. So I don't know if that's going to turn students off when they see the length of the video, or if they will be, maybe they'll still like it and they'll just kind of fast forward some pieces and then, slow down on some of the pieces. I'm going to, I think in the future, be real cognizant of the length and try to really get succinct just because they do get to be a little lengthy.
And while they were in, yeah, it was a little lengthy, but I think the engagement part will help make it not seem as lengthy because I know like I've had ones that are an hour that's just a PowerPoint.
Right.
And there's no animation, there's no movement, there's nothing that's engaging with it. And I mean, an hour of watching a PowerPoint is really painful. So this one ended up being right around like 48 minutes or so.
Mm-hmm.
But we were also dealing with three different topics. And so, like, one thing I'm thinking about for the next time we do this is can we break them up into smaller pieces? So, we did acute kidney injury, chronic renal failure, and nephrotic syndrome. And we did it as one. So, like, my next thought is going to be like, okay, let's do just acute kidney injury as one, and then do chronic renal failure as one, and try to make them a little smaller. So, that would be like, 15 to 20 minutes each. And so they would be a little more kind of micro learnings. But
Right.
like, but like what Riki said though, is for the online students, because our students, when they're online, they don't ever come to campus.
Mm-hmm.
So coming in to do VR is not something they can ever really do unless they're going to take time but I mean, they paid for a course to not come to campus on purpose. So this is a way to still use Acadicus for even students who aren't on our campus, who are just learning remotely. And so they're still getting the benefit of the work we're doing with virtual reality.
Well, and I teach, in person as well. And for that group, I do a simulation, an actual simulation with one of the mannequins with the group. And I'd recognized that my online learners were missing out on that simulation. So last semester I did record one of them and posted it, but it's not very good. The camera is way back here and it's kind of echoey and hard to hear, hard to see. This seems like you're so much more immersed in, the situation with the VR. I really like it. And I think there's some entertainment value with it too, to kind of see what the VR can all do. I really liked how Mitch didn't keep the 3D camera in one spot all the time. He would do a lot of transitions where it's moving around, and it keeps you more engaged, I felt.
So just to kind of take a step back and get a little bit more in the technical side of things. So you were using a catechus to basically, Riki, put on a VR headset, right? So you're in the lab and you put on a VR headset and you've got the lecture in mind that you want to teach, and you've already got a scene created in a catechus that's aligned with the objectives that you're after. And you use the 3D recording feature. So you're in the headset, you hit record, and you perform your presentation, your demonstration, your lecture, and then you hit stop. So you've got a three-dimensional, like 3D holographic recording of your instruction in a catechus. And because the students aren't coming to the VR lab, like you just said, you're basically sharing that by capturing a video of that three-dimensional lecture and putting that out instead of a PowerPoint lecture. So it's the main use case here is, if I'm understanding correctly, it's really increasing engagement, creating something that's more interesting, more interactive, more engaging than watching a PowerPoint or just a lecture without any kind of visuals. So that's kind of the use case, using a virtual reality platform to extract that lecture into a video format so that students can access it from anywhere. Is that right?
Yes, and it really captures application of what they're learning too. I've for a long time recognized that when I'm in clinical, if I find a really interesting patient, say that has chest tubes and they've never had chest tubes before, I will ask the patient if I can bring the group in, and I will basically do a mini lecture right there with the patient there, and do an assessment on it and show them how the chest tube works. And the students seem to go, now that makes sense, that they can really see it. And that's what VR is, just one step below that. I like
Yep.
it.
Yep, absolutely.
Yeah, so
Absolutely.
I
And then
took her
you,
PowerPoint and I captured it as images. So I pulled it up and just did screenshots because we need that JPEG or PNG format file to upload into the image viewer. And because the image viewer, you can make it a slideshow. So I just put all of her slides in there. And so then as we went through, and I would just change the slide, and then we would record the next piece, and we broke it up into individual, like every slide has its own recording, because that was easier. That's what allowed me to kind of do the different camera angles and move around, so that we were able to kind of figure out, to again give that transition and movement, so it was not just that fixed camera just sitting there staring the whole time and nothing ever really moved. Because the reason I did it as individual ones was because, like, the next time, so let's say that something changes in the practice of how we care for these patients, Riki can just make one slide, send it to me, I can upload it, we can then let her record that one piece, and then I can capture that through a screen recorder, because I use ScreenPal to like record my screen when I went back and played it, and then use that to, I can just take out the old slide, put in the new slide, and now we're ready to go. Which we've got to do because I made a boo boo and accidentally deleted one of her recordings and and duplicated one at the same time. And I was like, oh wait, yeah, that's twice in there. Whoops.
Yeah,
So,
that's okay. It wasn't the whole video, so who cares?
but again, it was one thing, so she'll be able to come in for 10 minutes
Yeah.
and we'll be able to go through and fix it really easily. And make those edits and changes, it'll take me probably an hour to do the whole thing and get it all, finished, touched up, and ready to go back out. So
I think just a minor point is that I had expected when I'd see the video that it would be like a bubble of my face. A picture, say that Mitch grabbed from NWTC or what have you, but instead it's a generic looking kind of robot with the Oculus on. And I actually prefer that because it looks more realistic. It's not just a bubble floating around. And and it's amazing, like as my hands move when I'm talking or approaching the patient or just talking with my hands, you can see a set of hands doing what I'm doing, which I thought was nice too.
Yeah, absolutely. And you could even potentially, if you're using, were you using an admin account for the recording?
So
Do
I
you
had
remember?
her logged in as a guest account,
As a
and
guest.
I
Okay.
logged in as an admin because, I don't ever expect our faculty right now to know how to do all the inner workings of Acadicus
No,
because,
absolutely.
well, we got a new LMS last year. We opened the lab last year. Like there's been a lot of
Yeah.
change and transition in our college. And so I'm not like, oh, by the way, learn a whole new platform as well on top of it.
Yeah. Yeah.
That's just
Yeah.
too much. So
Well,
I just logged in as my admin account and went into ghost mode. And so then Riki was across the lab at one of the stations in guest mode. And so what I did is I was in there, but since I was in ghost mode, no one could see me in the recordings. And I
sure.
just did the recording. And then so she would say, I'd say, okay, recording's on. She would count to three, so that would give me time to like chop off me saying recording on. And then when she was done, she would pause for a second and then say, okay, next slide. And then that would allow me to slice off that piece. That way it was a clean, time of her talking without any extra, of us chatting or trying to figure out what to do or, okay, now we're doing the next thing. So let's do this. And do you want to move here? And then I could also control the patient. So like there's times that when she's doing interview questions, I make Vincent like nod yes or shake his head no. And I move him around in the bed for her. So like when she wants to examine his heels because he has wounds, so we're able to kind of do some of those other things. And I was there to kind of help facilitate that. So again, the faculty aren't having to figure it out by themselves.
Excellent.
It's
Excellent.
some of the unscripted stuff that's kind of cute too. Like Mitch said, I didn't know he was going to do things like nod the patient's head. So I'm talking to Vincent, telling him he needs to increase calcium in his diet. And I'm giving him some options of things to start eating and drinking. And one of them was sardines. And all of a sudden Vincent goes, so, I'm kind of surprised too. And I'm like, oh, I take it you don't care for sardines.
That's fantastic. Well, yeah, the only reason I mentioned the admin account is if you do capture a recording as an admin, then you can save the profile photo above your head. You know how like it's that blue avatar? If you use an admin account, you can click on that icon in the upper right corner when you're logging in and upload a profile photo. So then you kind of have like a typical little profile photo. I think it's totally fine without it, but just kind
Mhm.
of a pro tip kind of hack. You can record that in and you can add it later too. It's like whatever the current image is associated with that account is what will play in all previously recorded 3D recordings. So that's kind of an extra, a little fun because your students like to see that it's you, and they can already tell because they can hear your voice and see your gestures, and it's pretty easy to kind of connect that. But that little extra profile photo gives you a little more connection that way.
Mhm.
Yeah, as we do more of these now, that's something I want to do. But for the first, attempt at it, I'm like, okay, let's keep it as simple as possible.
Keep it simple.
Let's
Totally
not have
agree.
too many variables
Yep.
because as much as I know a catechist and can work with it really well, you still want to take things slow and
You
steady in the
too.
beginning because I'm like this, just trying to figure out how to manage everything with it and get everything put together. And um, that was kind of one of those things where I'm like, okay, let's not have any extra pieces that I have to worry
Keep it
about
simple.
dealing with in the beginning. Because like we have some generic accounts, admin accounts at NWTC. And so in the future, like I'll probably use those. But like I said, for this first round, I was like, let's start simple. We'll work on tweaking and making things a little cooler each time we do it and having new features
Mhm.
put in. And But and Ricky's already said that she's ready and she's excited about doing, the next ones now because she
Well,
liked
they'll
how,
get easier.
yeah.
Well, in
And we had
terms
to
of,
record
one of the
twice to do
yeah,
that.
and yeah, absolutely. And what we like to share, in Pulse Live as much as possible is like tips and tricks. And I think what you just said is exactly that, is like starting keeping it really simple to begin with. I think a lot of schools miss that and they try to just jump all in and we're going to do high fidelity simulation and try to do all of this, and it just start simple, start really simple. And I think that was a great way to a great place to start. And what's exciting from my perspective is, we built this platform, trying to provide as much flexibility as possible. But we didn't anticipate some of these use cases. I don't think any of us, when we were first building Acadicus, imagined that people would use a 3D recording feature in this way to have an instructor and they're doing a demonstration that's captured as a video, uploaded to LMS. But what a brilliant use case, and I know, that's becoming kind of an emergent way that Acadicus is being used by schools, and they're providing, they're getting a lot of value from that, even though they're not necessarily bringing all the students into a fully stocked VR lab. It's a very lightweight, easy, accessible thing. You can do it on your phone from any location with or without high-speed internet. There's a lot of value to that. And like you say, it's not always possible to do these things in a sim lab or with a live patient. So where that's not possible, this is a nice kind of backup alternative. So it's exciting to see that emergent use case, and really,
Mhm.
yeah, really appreciate the innovation there. So how was it different in what ways? You've already covered some of that, Riki, but like in terms of like if you were giving this lecture live versus you're in a VR headset, that must have been pretty strange at first. Like, was there a process to get used to that? Were there differences, and like how was that experience?
It was really awkward at first, and in fact, Mitch goes, "Is the headset not on tight enough?" And I'm like, "No, it's tight enough." And he goes, "Well, you keep putting your hands up," and I think it was just a nervous thing. Like I was just adjusting it, not used to it being on my head, whatever it was. So I had to like stop doing that fidget. Um, and it worked out good. We did it one time, but then we decided we wanted to do some better things. So we just re-recorded the whole thing. And I thought it went much smoother that time. So I think every time I do one, it will get easier. Um, it's still always just a challenge not to have any people there looking at you, talking to you, asking questions. It's just you. So um, that's just always
Absolutely.
the challenge.
Yeah, that's the thing with 3D recordings. We found that a lot. I know I've done a few of them in there, and it's always weird because you don't know where the person who's going to be watching you is. Like you could be, especially if they're coming in and actually going to watch a 3D recording in a scene, like you don't know where they're going to be. They can be teleporting they could be behind you for all you know. So we, sometimes we'll just put like a character, like a human character, just in the scene to give the person recording something to look at least knowing that that's where the person is and they can kind of orient to that. And like you said too, I think I missed that earlier, that in terms of tips and tricks, it's like starting simple is the first part of it, but recognizing that you're going to innovate, or I mean, not innovate, iterate. So you're going to be like doing this over again, and every time you do it, you'll get a little bit better. Maybe next time we'll try this, next time we try that. I think that's also a really important tip, that anybody that's going to attempt to do this should think about that, beginning with the end in mind. The first time you do it, it's going to be really awkward, it's going to be hard to get used to. There will be a process there, but the next time you do it, it'll be a little easier, and you're creating these resources that are going to be valuable for potentially years to come, right? I mean, they're not going to be obsolete right away. Like these are important, these are integral kind of lessons that you'll be able to reuse, which is really cool.
Yeah. Yeah, I've already talked to, some other faculty. It would be nice, because it takes time, right? To get this prepped and to record it, and it takes a lot of Mitch's time. But it would be nice if I could get some faculty to team up with me, and then we could, split up some of these systems. Somebody does endocrine, one does renal, and then we can share all of those.
That would be amazing.
Yeah, divide and conquer, and and I'll say like the process total, like Ricky and I met a couple times to talk about like, okay, what do you want in the space? What do you, and so like I brought her in and put in her headset once and we went through the tutorial, and then I was like, okay, like here's the kidneys we have, here's this we have, and we kind of just plotted and planned out all the things that she would want. And then like I put a table in the room and I kind of put all the supplies that Riki wanted there. So that way then it would, instead of having to constantly like reload new scenarios or change things up a ton, she could just go over and get the supplies she needed. And then when she came in, like it was funny because I had things all on the table and she came over and she was like, "Nope, I want this over." And she, in her headset, she just went over and grabbed it and moved it. And I'm like, "Save." And then it just saved it where she wanted it and what was intuitive to her for that time. And so, like, now that I have that space saved, I don't have to recreate it again. All I have to do, if she
Mhm.
wants to do another recording, all I have to do is upload the new image in and we're ready to go. So I
Right.
can save. So like if she wants a different one for endocrine, okay, great. We'll go in, we'll design that space. We'll take the one that's there right now that has Vincent in there. I'll change out a few things if we need to and hit save and save it as a new lecture recording space and boom, we have another one. And so like now that we've got the first one done, all of the subsequent ones are going to go so much faster because we're just going to use what we have, make a few tweaks in the moment, and then hit save. And we're ready to go with our next version of the next lecture.
Yeah, you've got a stage set, you've got all the props, they're all saved in the scene. So it's an instant load. Like the next time you do it, you just load that scene up and everything is exactly as you need it. And like you say, making tweaks and modifications over time to keep improving it. It should be, easier and easier, but you've got the stage set and you've got all the props in place, and that's a big part of it. That's great. We should have probably done this earlier in the episode, but do you mind if I share a clip of the
Sure.
recording? Is that all right with you?
Yeah,
Okay,
that
cool.
sounds good.
Okay, cool. I'll play a few seconds of it here. Let me see if I can share with video and sound.
And Rick commented, he said, I got to see a clip and was really drawn in by the scene and the interaction. So
Great. I certainly was as well. So let's see. Oops, I can't hear. There we go.
Depends on what phase of acute kidney injury he is in.
Let's see.
All right, so let's do an assessment of Mr. Jackson here. Kind of thinking about ABCs, I think a good place to always start is with vital signs. So I would want to get him, let's get his O2 sat. And we can see up on the screen that he's at 89%. All right, well, guess it's a good thing we started with oxygenation. Let's get some oxygen on this gentleman.
like Ricky said, being able to see this happen live in the moment and be able to, understand, and it's bringing some of that
We'll start him
abstract
at
stuff
2 liters, and hopefully that gets his oxygen level up into the appropriate range. I'm not too surprised that his oxygen is low because he has all this fluid volume overload. So that fluid is probably spilling out into his lungs, making it difficult to do air exchange. All right. And then breathing. He's got a respiratory rate of 28. This isn't too much of a surprise either. His body is compensating, trying to bring in more oxygen since his O2 sat is low. So that's kind of expected here. And then his heart rate, he's at 104. Again, not too surprising because his body is compensating. His heart is trying to cycle oxygenated blood as fast as it can to deliver oxygen to the tissues. And then blood pressure, 165/92 is high. Again, this would be expected because of all that fluid volume overload. All right. Let's listen to his lungs.
So this is where I was controlling so like I was able to click off the shirt and kind of just to make things easier for Riki so she wasn't having to mess with things while she was trying to teach.
All right, those sound clear.
It wasn't too easy to hear the breath sounds, but you get the point, right? Because I tell you what I'm hearing.
I was anticipating because of all that fluid volume overload. Both bases. And of course, if this was a patient in clinical, I would definitely want to listen posteriorly. And in listening to his heart, I can hear an extra S3 sound, which is typical for patients that have fluid volume overload.
Oxygen's going up.
All right, so we can see here on his leg that he has, I would say, 3 to 4 plus pitting edema. And that's on both legs. So again, expected for somebody who is in fluid volume overload. He has the shortness of breath. As far as urinary output, I would expect that could be high or low, right? Remember our urimeters over here. It just depends on what phase of acute kidney injury he is in.
So yeah, that's amazing. Very well done. I mean, and you've created this scene, and I'm just looking around, and if for anybody that's joining that isn't already familiar, Acadicus is essentially a sandbox. So all of these objects are individual, what we call assets or props that are basically creating, like I said before, like a stage set. And so schools and organizations that are working with Acadicus, some of them will sponsor development of custom content if it doesn't already exist in the library. And at this point, we've got a pretty substantial library. I think there's over 1,000 different prop assets in there. But looking here, I can see that Vincent was a patient that was created, I believe Madison College sponsored development of Vincent, and he was a Gen 2 patient. So Gen 2 patients are basically high fidelity virtual mannequins that have a lot of capabilities. The anatomy was brought in by Cochise College in Arizona. And I know the vitals monitor was something that Dr. Slayman was looking for at DuPont Children's Hospital, Nemours DuPont. The oxygen meter was Laurel Technical Institute. The IV pole was Chamberlain School of Nursing. The food, the bananas and the orange juice on the tray there, that was a project for NSU that we created for their geriatric program. And the environment they're in is actually a pediatric ICU replica of a hospital that we were working with as well. So there's just a lot of different pieces in here. And I'm just kind of like walking through memory lane here, thinking about where all these assets came from. But it's cool that you were able to take all those different assets that were created by all these different resources and pull them in together to create this scene to meet your objectives. I think that's amazing. And the lecture quality for your very first lecture, that's fantastic. Great job, Riki. That's amazing.
Oh, thank you.
Well, and it was one of those things where, because we have a large amount of online students and we do a lot, every class we have is all flipped classroom. So, because students are expected to watch their lectures kind of as their pre-work, and then they come into the classroom to do active learning. And what I'll be excited about to see this semester is if Riki sees a difference in how her students do during active learning time in the class. When, if the concepts make more sense, because, and I also want to know what kind of questions they're asking. Are they asking deeper questions that are more meaningful versus trying to just now explain this to me again? It's like, okay, it was covered in your PowerPoint, but
But they were sleeping.
or they were listening to it as they were doing the dishes because it wasn't that interactive or fun to watch. So,
Yeah.
and while it's still, material that's, not necessarily, I won't say, as entertaining as like a YouTube video watching about cats or someone falling off of a ladder or something, but it still is way more entertaining and engaging than words on a screen or even just flat pictures that don't really move. And so, and my favorite thing was like being able to listen to those like lung sounds and explain like, yes, this is what, because we say crackles in the lungs, but students don't always get that in their brain when you're just saying, well, we would assess them and we would expect for this, this, and this. But when you can actually see it happening and getting all those different learning styles together at one time, it's just going to make that information that much more present in their brain.
Yeah, absolutely. Yeah, and I just want to double click on one point that you made earlier about the, studying the efficacy of it. You're basically measuring to see how students do after, they experience this. So before, obviously, you didn't have this kind of lecture. They were taking an exam and you have results from that. And now you're going to compare that to results after they've had this opportunity to see the virtual lecture and see how they compare. which I think is amazing. And that's something you've been doing at NWTC since the beginning, since you build your VR lab, is you've been, continuously measuring and studying to make sure that, it's actually making a difference. It's not just a shiny new thing, because I think a lot of people look at VR and they're like, well, this is just a shiny new toy, and, students love it, sure, but like it's just a game, but what you're doing in terms of measuring the efficacy, I think, is what's helping to continuously sort of strengthen your program, because you can demonstrate that ROI over and over again and say, like, there is real learning that's happening here. It's not just something that we're doing for a marketing soundbite or just because it's a cool thing. This is actually making a difference for students. So I'll be excited to see the results as well. If you're able to share that at some point, we're always eager to see how things are going and how we can continuously improve.
Mhm.
Well, and so far from our blood administration activity, we saw about a 15% increase in student grades on their blood administration competencies. And we don't, I mean, I can't say that how much of it is, VR, but over the last year, we've had a 10% increase in student persistence. So, since we've integrated VR into our and using Acadicus into our curriculum. So like we are seeing positive results, and I mean that's just in the first year, while still trying to kind of like get our feet underneath us of how do we use this to its best abilities. This is that first pass stuff. So as we keep going with it, I'm expecting those numbers to continue to rise.
And are you measuring this with surveys? Is that correct?
Surveys, but also actually like so the surveys is more about student experience and what they would like us to do to make things better. I'm actually like we actually saw a 15% increase in grades on their exam for blood administration in our advanced skills class. Because we had 33 out of 39 students pass on the first attempt of that competency, and that is unheard of for that skill. Normally, that pass rate is usually about like 65% on the first attempt. And the ones who didn't pass were much closer to passing than they would have, because they're required to get an 80. And the lowest score we had was a 75%. So the numbers were way better than we even thought they were going to be.
It's amazing. Very, very cool. So what's your perspective? What's next? What's the next iteration? You've touched on that a little bit, but in terms of, both, just individually Riki's next step and then NWTC as a whole, like where are you going next with this?
For me, I would say renal and endocrine have always been my second semester students' toughest points. So I'm going to move on to probably endocrine next, especially some of those hormone problems, SIADH and DI. I think those we could really show off with a patient if you were actually assessing the patient. Somebody that is, again, fluid volume deficit or overload. Some of those extreme imbalances that I've never even seen in practice, like maybe malignant hyperthermia. There's some things out there that would be great in VR because we just never see them in practice, but they will be tested on NCLEX. So, and hopefully we'll remember some of it at some point in practice if they do encounter it.
So what I'm hearing you say is like you've identified difficult things that the students struggle with
Yeah.
perpetually, right? So you're identifying those difficult areas and then mapping these VR experiences to that. Yeah, okay, cool. That's amazing.
Like for SIADH and DI, we have the light board. I don't know if you've ever heard of that. And I've done light board videos where I've drawn like a patient and what's happening with fluid and everything. And the students really like it, but they're still struggling. So this could be even better.
And so it's things that the students are struggling with, but like you said, also rare and unusual conditions that they won't see in
Yes.
clinical practice necessarily. So that's another use case for this, is really dialing in on things that you can show students that they might not see in their clinical rotations or even in their careers for many years, but at least you're demonstrating something that will hopefully be memorable in case they encounter that eventually.
Correct.
Well, and like she said, I mean, we don't know what's on their NCLEX, and so we have to have them prepared for all the stuff because they get I think the maximum number of questions you can have on NCLEX is 265. So I mean, there's 265 possible questions out of thousands of topics. And so trying to, make sure that they have a strong enough knowledge base to be able to answer all those questions and then in practice even be able to use that knowledge again. And so, trying to make something that's more memorable than a really boring PowerPoint that is
Yeah.
hard to stay awake during.
And I also feel like in VR, I was able to, especially, I think in just about most of the things I lecture on, you could really get concept based, like for renal failure. If you watch the video, I talk a lot about fluid volume overload. I don't want to talk about acute kidney injury or chronic kidney disease. They just have to remember that the patient is in fluid volume overload. So that should get them through just about any NCLEX question.
Yeah, getting those concepts of things and because Riki says fluid volume overload a lot but it's like she keeps talking like because because of this issue, the patient's in fluid volume overload. So we've got to deal with the fluid that's here that's causing the problem. And being able to keep going back to that concept of fluid volume overload because fluid volume overload doesn't affect just kidney. That can appear with congestive heart failure, that can appear with numerous different diagnoses. And so if they understand that concept of what to do with someone who has too much fluid on board, they're going to be able to deal with a plethora of different disease processes, and that knowledge will be there. And being able to again see it kind of live on that in that moment just makes it that much more applicable because you can memorize all you want, but if you can't take it to the bedside and use that knowledge in a meaningful way, then students aren't going to do well as nurses. They're going to struggle. And so like I think being able to see it at the bedside and applying the knowledge to a patient in the VR world is really helpful to help those students who struggle with how do I take this stuff I've memorized and do something with it?
Yeah.
Apply it. Mhm.
Because that's how NCLEX questions are written. It's not like your patient has these symptoms. What's the disease process? It's your patient has these symptoms. You're the nurse at the bedside. What do you do next? And so by being able to see what you do next, instead of just having a list of bullet points that says, for this, you do this, for this, you do this, and da 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 da, it's like, oh yeah, here's the things I do.
Mm-hmm.
That makes a lot of sense. And, I think coming back to this idea of iteration, there's also platform iteration that we're working on, to keep making the tools better. And I imagine a world where, even nurses in practice, before they're going in to deal with a patient that has a difficult or a rare condition, maybe they just go over into the simulation bay, put on an Apple headset or whatever it is at some point in the future. And, they're looking at maybe it's some sort of approximation of the patient they're reviewing, they're priming themselves to go in there. And then when they go in and work with that patient, they've got deja vu. They just did it in the simulation bay, and maybe there's a simulation capacity on every floor of every hospital at that point because they're lightweight. They're less and less costly over time. They're higher and higher resolution. These things are going to become something you can just fold up and put in your pocket, like a pair of sunglasses. So it'd be great to be able to integrate that to prepare, practicing nurses as well.
Mm-hmm.
Well,
Absolutely.
yeah, especially because, patients are so different and not everything always presents the same. And so, having something that can help you with like, oh, okay, what do I do it? Because I think about, we get very specialized because like in hospitals, you have the cardiac unit, you have the neuro unit, you have the ortho unit, but sometimes those units get full. And then you have to overflow a patient that, is a cardiac patient onto the medical unit or to the ortho unit. And the ortho nurses are like, I don't deal with this. I don't know what to do. And, that way to kind of refresh themselves because, I mean, as we hospitals are always busy and full. So there's not always a space on that specialized unit. And so being able to have a way to, because we all have all the knowledge, but you kind of lose it a little bit when you're not using it. And so having that refresher of like, oh, okay, yeah, that's that process, and here's what I do. And so having that quick refresher just to help make sure that our nurses are competent even when they're doing something they haven't done for a while.
Yep, that makes a lot of sense. Another great opportunity. Well, I guess I don't have any other questions for you. I really appreciate you joining today. This has been fantastic. Is there anything left unsaid that you want to share or anything we didn't cover?
I think I'm good.
This is fantastic. I really look forward to learning more about the program as it's evolving. And Mitch has been sharing with us, on a lot of these episodes, and we're tracking your progress, with excitement. So thanks again for sharing all this and joining us on the Pulse Live.
Thank you for having me.
Thanks.